If you're an older guy wondering which ED medication, Tadalafil or Sildenafil, is the better option for you, you're definitely not alone. It's one of the most common questions I get, and with generics now affordable, it's a lot easier to explore your choices without breaking the bank. So let's break down the big differences and help you figure out which one might fit your lifestyle best. Both Tadalafil and Sildenafil work in pretty similar ways. They're called PDE5 inhibitors, which basically means they help more blood flow to your penis when you're aroused. But here's the thing, these drugs don't boost your desire, they just help you get and maintain an erection when you're already in the mood. And just to set expectations, neither one is guaranteed to work every time, especially as ED progresses. Dose changes over time are totally normal, so don't be discouraged if things shift. Now let's talk about how fast they work. Both take about 30 to 60 minutes to kick in, but Sildenafil, yep, that's generic Viagra, peaks a bit faster, usually around 1 hour. Tadalafil, which you might know as generic Cialis, takes about 2 hours to reach its peak. So if you're planning ahead, take your pill an hour or two before you get busy. But here's a heads up. Sildenafil can be slowed down by a big fatty meal. That means if you're out to dinner, it might not work as well after a steak and fries. Tadalafil doesn't really care what you've eaten, so it's a little more flexible. I sometimes suggest Sildenafil for guys in long-term relationships with a predictable routine, and Tadalafil for those who are dating and want spontaneity. When it comes to lasting power, Tadalafil is the clear winner. Sildenafil works for about 4 to 6 hours, while Tadalafil can keep you ready for action up to 36 hours. Some folks call it the weekend pill for a reason, but remember, neither drug will give you a marathon session unless you're actually aroused. Side effects? They're usually mild, but they're not identical. Sildenafil might give you headaches, flushing, or even a blue tint to your vision. Yes, really. Tadalafil can cause back pain, a cough, or stuffy nose. And since Tadalafil hangs around in your system longer, those side effects might linger a bit. If you take nitrates for heart issues, neither drug is safe. Talk to your doctor first. Now, do these pills cure ED? Not really. Think of them as a boost, not a fix. ED usually gets worse with age, and while these meds help, eventually, you might need to consider other treatments. So, which one is best? Honestly, it's personal. Some men get better results with Sildenafil, others prefer Tadalafil for its flexibility. Try both, safely, and see what fits your life. And remember, you're not alone on this journey.